Today we're going to conclude our guidelines for ICD-10 PCS. This is part 4. The first one we'll look at is the open approach with percutaneous endoscopic assistance. And this guideline just tells us that if we see the phrase percutaneous endoscopic assistance, that is going to be coded to the approach of open. The example given is a laparoscopic assisted sigmoidectomy. You see here the approach is coded as open. And the key word there is assistance. When you see laparoscopic assisted procedure, you know you're going to code it as open. The two examples given are the resection of the tonsils, where the surgeon can actually see the site he is going to be working on without any assistance from instrumentation. And the second is when the surgeon is going to be applying external force through body layers, and that would be an example of a closed reduction of a fracture. Both of those are coded as external. The key there is there's no cutting. Nothing is cut through the skin, or the skin is not entered in any way. The physician can do what he or she needs to do externally. The next approach is a percutaneous procedure using a device. The example given is fragmentation of a left kidney stone, and it's being performed using the percutaneous nephrostomy tube that you see there as an image taken from Google Images, where you see patient's kidney, the tube going from the kidney to the outside of the body to the catheter bag. Guideline B6 are the general guidelines for device use. The first one tells us a device is coded only if it remains after the procedure is completed. It is not unusual for a physician to use a device during the surgery. It isn't coded unless it remains after the surgery. There are times in some operations you're going to see the option to choose a qualifier that says temporary or intraoperative, and that's when these things are left in for a brief time, either during the procedure or during the patient's stay, and it's removed before they go home. There aren't very many that use that qualifier. More often you're going to be making decisions based on whether it's remaining or not after the surgeon has closed the site. Also remember that sutures, ligatures, radiological markers, and temporary wound drains are not coded as devices. Also, a procedure performed on a device only and not on a body part is specified to the root operations of change, irrigation, removal, and revision. An example is when you're going to irrigate an indwelling device like a Foley catheter. You're going to use an irrigating substance as your device. But you notice that this is coded in the administration section of the code book, not in the medical surgical section. A separate procedure to put in a drainage device is in the medical surgical section. For example, inserting a Foley. And you see there how it's coded. The device character number 6, is a drainage device. So in the first one, the procedure is on the device where they're irrigating a catheter or an indwelling device, and the second one has to do with actually inserting the device or the catheter. The next part of the guidelines has to do with the obstetric section, and specifically we're instructed that if a procedure is performed on the products of conception, it's coded to the obstetrics section. And if a procedure is performed on the pregnant female, other than the products of conception, you're going to go to the medical surgical section. The example that's given here is a diagnostic amniocentesis. That is actually a procedure that's going to be done on the product of conception, which that is a phrase you just got to get used to in the medical world. I prefer the word embryo or fetus, but the medical term is product of conception. And the repair to the mother, obstetric urethral laceration, would be coded in the med-surg section. The example I've given here at the bottom is the amniocentesis, and you see the body part is the product of conception. It's a percutaneous approach, and the qualifier is diagnostic. The next guideline has to do with procedures following delivery or abortion. One is a D&C of the endometrium, and you see examples that have been given are different in that one is postpartum and one is diagnostic. D&Cs are often done following an abortion or a miscarriage to scrape out the endometrium. It gets the bleeding to stop. And then the second example that's given is when that scraping is being done to see if something's going on. So it's a diagnostic procedure. So depending on the purpose of the procedure or the intent of the procedure is going to tell you which section you're going to be in. The next section is the new technology section, section X. And this is for those procedures that are being done, and you do not need any other codes from any other section in PCS. It's fully contained within this new technology code. And the example that's given is a patient presented with a complicated UTI with acute pyelonephritis, and he gets this very specific anti-infective substance into his central vein. And you see where it is coded in the new technology section, not in the administration section. Central vein is the body part, and then you see the device character is the very specific substance that this code has been created for. The qualifier is the new technology group 1. I have not used this section in my coding experience, but I'm sure if you were working in a facility that does a lot of research or a teaching school where you're going to do a lot more of those type of procedures, you would be using this section more often. This concludes our guidelines for PCS. I encourage you to look at them more than once, as well as reading them in your code book or your textbook. There are not as many guidelines in PCS as there are in diagnosis coding, ICD-10-CM, but they're just as important. So be sure that you are very familiar with your guidelines whenever you are coding your homework or working through your exercises in your textbook. Questions, please post them in discussion board, and I will address them there. Thanks so much. Have a good day.